Okay, I'm starting recording. Okay, good morning, everybody. I'm going to go ahead and get started. I know that for some reason this day turned out to be not such a great day for everybody, but I am going to record, and so for those of your colleagues that were not able to join, hopefully they will watch this. So I'm very excited to have Sarah speak to us today, and hopefully this will be a discussion and sharing her journey in Rutland, Vermont. And I met Sarah this last 2 years ago, I guess, a year and a half ago, when I did similar work that I'm doing with you all in the state of Vermont. They had 10 different hospital service areas that participated in an ACH learning lab, and so Sarah was the lead for the Rutland area and participated. And this is such a great story. I heard her give this presentation with her colleagues last year at the Association for Community Health Improvement, which is a hospital association conference, which actually I think is next week in Atlanta. I don't know if you're going to that, Sarah, but and just wanted you to hear kind of the outcomes of their work. So with that, I'm going to turn it over to Sarah.
Great. Thank you for inviting me to share our story here in Rutland with California. I think that's rather cool. Just a little bit about me. I know, can everyone hear me okay? Sue,
yes.
Can you hear me?
Yeah, I can hear
good.
you great. Yes.
Good. I don't want to continue on if I'm garbled. So I have worked at Rutland Regional Medical Center for over 30 years and just left that position to join the University of Vermont's Department of Nursing. This is my first semester there. So the information here is still pretty fresh. So I am thrilled to be able to talk about the journey that Rutland's been through. And so just a little bit about Rutland and where we are. I thought when we went to a national conference, it'd be great to put us on the map. So you can see we're one of the 6 states in New England up there, and Rutland is pretty central. We are anticipating a big storm tomorrow, probably 12 inches of snow. And we won't be seeing a rainbow that you see in this picture here. This was taken in our downtown. It's a couple of blocks of buildings downtown, and that's about it. Other things about Rutland itself is a tiny city of 16,500. Our county is also called Rutland. It's Rutland County, and we have 62,000 individuals in the county. And our hospital serves that area. And so I'm going to tell you a little bit about the story about Rutland. Rutland is definitely economically challenged. It used to be the hub of the train transportation system probably 100 years ago, but it has certainly suffered and really have lost a lot of industry in the last 30 years. The growth rate of the population is stagnant, and it struggles with a lot of poverty. And as we moved into this ACH, which we didn't even know what an ACH was, but Project Vision evolved because we had some traumatic events in the community that really had us struggling. And so what I'm going to do is give you an overview of Project Vision and its community engagement strategy, talk about the Vision Center, also how we are changing the quality of life in a very high-risk neighborhood, and then talk about what we're doing to address addiction treatment. So it all started back in March of 2012 when we had a new police chief come and really turn our law enforcement department upside down to be much more proactive, much more community friendly, much more approachable, and committing to having being the backbone for Project Vision. So this is Police Chief James Baker, who actually left us to go to Washington, D.C. and run a sheriff's national organization there. And we've had a new police chief come, and still Project Vision continues. So it's great that, you know, it lives beyond the leader that initiated it. What really jump-started Project Vision was a catastrophic death. This young lady, Carly Farrow, died while she was walking to her car after she got out of work. There was a young man in a car who had been huffing, and he hit the accelerator and was going 80 miles an hour in the city area, hit a car which crushed her against a building, and she died. She was a senior in high school. She was a rising star, you know, going to be going off to college, and it just really shook up the community, and people said, we need to do something about this. And that's when Project Vision was hatched. And it really evolved out of law enforcement and changing, going door to door, meeting with people, being available at this coffee shop for the, you know, come and meet and greet with the police chief, tell them what's on your mind, doing a lot of media education, meeting with people, and using data to identify hotspots, areas in the community that had higher needs that law enforcement were always getting called to. And I'll talk a little bit more about that. But it was truly grassroots outreach, and anyone is certainly invited to the table. We saw a lot of representation from different groups, including our faith community, come to the table. So as it evolved, you know, when I think about governance, this is about as detailed as it gets, that we have Project Vision. One of probably the smartest things that occurred was having Joe Kraus chair Project Vision. Joe Kraus worked for a for-profit organization that got bought out, and he, still in his prime, had lots of energy to give back to something. And he was an executive, a lawyer, and now he chairs Project Vision and is just a great voice and a great cheerleader. There is an executive director of Project Vision who works for the police department. It was Scott Tucker for about 4 or 5 years. So I was just telling Sue, he was forced to retire at 60. And so the baton was handed to Matt Prouty. So he's only been in that position for about 4 months. So again, one more transition. There are 3 committees in Project Vision. One is crime and safety, one is about neighborhoods, and one is about substance abuse. And so those are very active groups that meet routinely and get lots of great work done. In the center column, you'll see the Vision Center. That is a room within the police department where it's kind of an eclectic group of people sit in their cubicles and work together. We have mental health individuals, social workers, Department of Corrections, Probation and Parole, Southwestern Vermont Council on Aging, which is interesting because a lot of calls that the police are going out on are safety checks for elderly people. They may have dementia, they may have alcohol issues. So having a caseworker right there in the office is great. They can be, you know, pulled to go out on a call with the police. You can see there's a number of other organizations there as well. And then there's a community response team that they put together to address many of the repeated calls that happen in the community. So important things about Project Vision. There's been a lot of door-to-door work, so walking the walk, but also doing that strategic planning. Every couple of years, the group sits down and looks at what it's accomplished and where it wants to go and identifying the needs of the community. Most recently, I was very active in addressing the needs related to health and how do we move from being reactive to addiction to being more proactive in preventing addiction. So that was a great opportunity to engage healthcare providers in the conversation. It's been a great opportunity to watch this 9-block community that's been targeted as being very high risk come together and have block parties, getting to know their neighbors, and making it a much more appealing neighborhood. There was originally a very high rental rate in that 9-block area. When people don't own things, they may not be as committed to keeping things up and working with their neighbors. So there's been a lot of effort that I'll talk about that's happened in that community as well. So this is Joe Kraus. He is the chair of Project Vision and a great cheerleader, and he shows up at just about every meeting possible and lends a voice, a hand, and isn't shy about knocking on the doors of other executives to get them involved. This is not my area of expertise, but this is Dr. David Kennedy, who did come to Rutland to share his expertise as coming from the John Jay College of Criminal Justice from New York City. It has really helped law enforcement change how they approach the addiction issues, the fact that there's drugs coming into Rutland from New York City, from Massachusetts, up from the Springfield area, and working, with both local and national law enforcement to truly change how they're dealing with the drug marketplace. So once again, I think, what we're talking about here is that vision center, and I'm using Scott Tucker's slides here, an orchestra in perfect harmony. So, to walk into this room full of cubicles and seeing people from a variety of different organizations sitting there doing their work, I think is very innovative. And the director of that center is the director of Project Vision, and it keeps growing. The newest additions to that center is 2 workers from Goodwill, and Goodwill is helping identify people who need jobs, help them get into training, and support them in their first 9 to 12 months in the job workforce. Because if we can get people working and feeling like they're valued, hopefully they won't be engaged in crime and feel like they have a purpose in the world. Other things that happen out of the Project Vision Center is data-based law enforcement. So here we have our data analyst on the screen here. You can see where all the calls have come in for the last 2 weeks. And every 2 weeks, there's a meeting called RUPSTAT, where anyone and everyone can come and sit down and listen to the calls that were made 2 or 3 times to the same address and what's happening there. It's such a switch from healthcare, where we have HIPAA and we can't talk about names and places and people, and yet in law enforcement, everything's public information. And there's so many times that they would discuss a address and what was happening there, and that fact that the individual needed to be transported to the hospital for some reason, that you can really appreciate why opening up the conversation can help identify who needs to be supporting the individuals living at that address, and how can we work proactively to make sure that their needs are being met, and that phone calls to the police don't keep happening for the same addresses. So it's certainly a well valued use of time to have all those folks, I'd say 50 people sitting in a room every other Tuesday morning listening to what's going on. And it's working. So here's data that's been collected since Project Vision started, showing that burglaries have reduced over time. The next is on larceny, a reduction there. And same thing with shoplifting. The Warratt that I attended started off talking about the repeated shoplifting that typically happens in a couple of the same stores because they're in neighborhoods where there's probably the greatest need. Quality of life. So this is a decrease in the calls for kind of quarrels between people in a neighborhood. And so when people get to know their neighbors and, they speak to them and see them face to face, they're less likely to get into disputes with them about their dog or their kid or, parking on the wrong side of the street, that sort of thing. Also, law enforcement took this approach to be proactive. And so they've got this van that they'll bring into, I call the 9-block neighborhood that was targeted. And they know if an address has been very active with issues and phone calls to police. And this van will just kind of come and park out on the street, and they'll open up their computers and they'll do some work right there from the van. And it really decreases the amount of calls to police from that neighborhood by just having a presence there. The other piece of changing the culture of the neighborhood was done by an organization called NeighborWorks of Western Vermont. When I say that Project Vision didn't require a lot of funding to do all the work they accomplished, one of the things that NeighborWorks has been able to tap into is funds to be able to renovate or tear down blighted homes in this neighborhood. And so a number of homes either have been torn down or renovated to become either single occupancy homes or just, gone from 4 apartments to 2 apartments to really reduce the amount of renters in this neighborhood and make it a more desirable place to work and live. The other part that NeighborWorks did was 2 surveys, going door to door, knocking on doors and asking questions. And so you can see from 2013 to 2016, people are feeling much safer in their neighborhood over time. And so a little bit of what NeighborWorks has done in that community, it's really gone beyond the bricks and mortar. It's really interesting to see this organization, this nonprofit, just do whatever needs to be done to change the culture. So there have been, one of the homes that was torn down was renovated into a park. Baxter Street Park had a grand opening where kids came out, and of course, we are the home of Ben and Jerry's, so Ben & Jerry's ice cream was served as well. Also, to keep the space contained, people donate, lots of donated help, volunteers, and supplies to build a community garden. And then lots of summer events where there was festivals with music. There was also just kind of fun activities for kids. They do barbecues, and lots of nonprofits would just come and pitch in and be there and make sure that the kids are having fun and neighbors get to know one another. And then there's movie nights. They take one of the vacant lots and put up a screen and, get the neighbors outside, watching a movie, talking to one another. Just creates, a great opportunity for people to connect. They also developed neighborhood associations so people can begin to address, the needs in the neighborhood and talk about how to make things better. And one of the grant-funded projects, and I say grant-funded, probably was only like a couple $1,000s, was a photo voice. And so about 16 of the individuals from this community were given a camera to just take pictures. And they, what are you proud of in your neighborhood? And they took these pictures that have been framed, and now they are hung in the hallway of the hospital. And they're just very touching, because what we might see as we drive through, we might miss some of the unique, beautiful things that those who live there appreciate. And then now a group has gone to a national conference and come back with a small grant, and they're continuing their art. So TAG is Together Art Grows for Project Vision. And they are bringing arts to the community to get the kids and the residents engaged in some fun activities. In promoting home ownership, Neighborhood Works also provided a seminar on, purchasing your own home. So this is an example of them educating those who live in that community. A little bit more about the survey to show the difference between 2013, 2016. The question of, compared to 3 years ago, how would you say your community has changed overall? And the first one relating to crime has declined a lot, has declined some, stays about the same, has improved, and has improved a lot. So lots of improvements. People are feeling much better about their community. In the next 3 years, how would you say your community is likely to change? One of the things about Rutland, and I was just saying to Sue, I mean, just the name makes you feel like, ooh, Rutland doesn't sound like this optimistic place to live. And so one of the things Project Vision has given us as a community is optimism. And you can see here that people are now thinking forward, thinking ahead, that things are moving in the right direction. I think they're going to be better in the future than they are today. So now I'm going to move into kind of the area where I spent a lot of time in work addressing substance abuse and prevention. And it really was, unfortunately, a perfect storm for us in Rutland, but also Vermont as a state certainly struggles with the amount of addiction and the need for treatment and support services for those who are impacted. And so back in 2014, our governor had the state of the state address totally focused on drug abuse. And I think that made national headlines because no other governor had just only focused on that. So Governor Shumlin's no longer our governor. He decided not to run after being our governor for many years, and yet we still, as a state, in our state legislature, I know that there are a number of bills still trying to address the need for substance abuse prevention and treatment. The other is a movie that was directed by Bess O'Brien, The Hungry Heart, looking at prescription drug addiction and recovery here in Vermont, telling our own story, making it nationwide, also came out at the same time. So a lot going on. We were on the cover of Rolling Stones, which still hurts us to this day that, Vermont is known in that way. So we are small and nimble and mighty in trying to deal with this, opiate addiction, and kind of from all sides that it comes into our community. When we look at the data, Rutland certainly has its challenges as we look at the percent of Vermonters receiving at least one opiate prescription by county. So if you can see Rutland with the red arrow there, 22% of the population, so highest there in Vermont, receiving a prescription for an opiate. So certainly from the medical side, lots needed to happen there to address, are we appropriately prescribing opiates to those who truly need them? And the state setting up this hub-spoke treatment model. And the hubs are methadone treatment centers. They are the yellow circles, and they're scattered throughout Vermont, so people should be able to drive to them. As you know, they need to go there daily for their treatment. And the spokes are outpatient buprenorphine prescribing practices. And those have increased dramatically across the state as we have been using state dollars to support putting a nurse and a social worker into those practices to help that prescriber in all of the supports those patients need. So this is what the hub-spoke model looks like on paper. The hub is your kind of specialized treatment center. They are resourced to those prescribers who are out in the community, but they also connect to the whole system of care from mental health, family services, corrections, inpatient, pain clinics. We call medical homes. That's our primary care system. And so even here in Rutland, these groups meet frequently to address what's happening with patients. How do we transfer them from one level of care to another, in and out of corrections, making sure that they're not slipping through the cracks. And then moving on to how does this change happen? This is a picture of one of our monthly project vision meetings. There's Joe Kraus there leaning up against one of the pillars. And, you know, people sit around in a circle and, you know, we share information, talk about some of the work that happens in smaller groups. A lot of work has been happening in the treatment and substance abuse, where we are trying to create one consent form that can be used across the community to share patient information. We are exploring the feasibility of opening a safe station, which is a place that people can go for help 24/7. And let me see, I think talking about the other things we've been working on, a lot of education about the use of Vivitrol, another, you know, option for medication-assisted treatment, making sure that, you know, there is access to Narcan throughout the community, and then educating providers and the community what to do if somebody suspects that an individual might be diverting drugs, whether it be the opiate or the Suboxone. And then I mentioned the consent forms. Other things that are happening to improve care. It's getting people to talk together to get to know one another. One of those efforts is called a coffee clutch. And once a month, a group of substance abuse and mental health providers come together before they start seeing their patients and sit down and talk about what they do, what patient most likely should be referred to them for counseling and for treatment. We keep an updated list of area providers and which insurances they take. And in terms of prevention, we started off with one drop box in the county for unused medications, and I think we're up to 5 or 6. So having more resources and encouraging people to dispose appropriately of any type of medication that might be sitting around their house that is outdated and they don't need anymore. The state has adopted a safe opiate prescribing law, which required a lot of education for many providers about having patients sign contract for long-term opiate treatment for pain, but even for the short term. We do have a system where the providers can check a listserv and see if patients look like they're doing opiate seeking from moving from, you know, one doctor to another. So there's been a lot of increased awareness. A lot of people now, you know each other face to face, and we are changing the thought of what addiction is, that it is a medical problem and that it takes a community to support people in recovery. And for that, we've been having annual recovery celebrations where the community comes together, and it's like a great block party. And saying that, you know, we want to make sure that those who are struggling with addiction get the support they need, and we're here for you. So a little bit more, you know, it's all about partnership. It's all about coming together. We are small. It's easy to pick up the phone and get the right people to the table. One of the issues that was identified is really trying to streamline admission processes. We want to just say there is no wrong door. If somebody shows up at your doorstep and you're not the person who can serve them best, that you'll make sure you'll get them to the right place. So with that is having one wait list. This is a dream. We're still working on it. One wait list for medication-assisted treatment. We know that patients may be calling multiple providers and getting on their wait list. So it's really hard to know, do we really have 100 people on a wait list, or is it 20 and they're just on, you know, 5 different providers lists waiting to get in for treatment? And I've talked a little bit about the other wishes that we're working on with the shared care plan and the safe station. So all of this effort, this perfect storm effort, is definitely making a difference for people, in that there are more resources for treatment. And the dark green line is the one where we're showing that we have almost 800 people in our community in heroin and opiate treatment programs. Our methadone clinic sees over 400 individuals, and then the other 400 are in outpatient settings. And what the state has said is that this system is making a difference, that, you know, people are staying in recovery longer, but also that their cost of care is less. It's not dramatically less. They had lower medical expenses by about $2,400. And when you add the medication-assisted treatment expenses, it was less by $412. But if we have people in treatment, that means they're not out in the community drug seeking, involved in criminal activity, making our neighborhoods feel unsafe, and impacting our quality of life. If they are in treatment, hopefully they're better parents, they're able to go to work and you know, address their own needs. So, you know, just looking at healthcare costs, it's just one small piece of the puzzle, but things are moving in the right direction. And this is a picture of a block party in downtown Rutland. That we love to get outside when the weather's nice in the summertime. And it's really a great sense of community, because wherever you walk, you run into people you know. And we want every neighborhood to feel safe. And it's been great to watch Project Vision grow. So we're into, you know, the 5th year of moving into the 6th year of the activities, and it keeps growing. One of the beauties is that there are very limited governance structures, so it doesn't get bogged down. And if people have a great idea, you know, the attitude is, you know, okay, go for it, do it. Let's see, what do you need? How can we help you? And so it's been great. As Sue mentioned, you know, 2 years ago, we started talking about our ACH, and we were almost kind of then reflecting on, so how does Project Vision meet the objectives of an ACH, and certainly does in many ways. And so I wanted to certainly allow for some time for questions and answers around, you know, what you'd like to know more about our journey and where we're going next.
Great. Thanks so much, Sarah. I love this picture. Vermont is it's an incredibly beautiful place, and you didn't mention the maple creamy ice creams in the summertime, because that's maple syrup, of course, is a big piece of Vermont. One thing, and I do want to hear from folks, it seemed like in your story there was this culminating event, right? Like something happened where people maybe were just like, okay, enough, that we need to do something about it. And so, thinking for the folks that are on, whether or not they've had that experience. I think the other thing I heard a lot of is just how embedded in the work that you've done, like relationship building and connectedness, huge. Where,
yeah.
right, like a lot of kind of very intentional about that, and that having somebody like Joe who served in that leadership role, who was really that champion. And I heard you say go door knocking, going to actual other executives, having that as part of the ACH structure, or for any kind of piece, I think is really, really important. And the fact that you're using, whether or not you called it that, but kind of the theories of change through networks, because the theory really is you go where your passion is. Like if you're interested in that, but that you're creating the space through the project for that to occur. So one thing, I'm wondering about is the data piece. I was struck by the police data and like how, the idea of like people coming together and looking at data. And I don't have a sense in some of the other sites how present that is, but could you maybe just speak a little bit about if there were issues in sharing that data and just kind of like what you saw as a result of that? Because that's a very different model, I think, than most of us are looking at prevalence of X or Y or something, as opposed to here's another thing to look at that's really getting at what's going on in the community.
Right. So, and I know from the law enforcement side, it was a true switch for them to begin to start tracking, where phone calls were coming from, and then looking at that to be more proactive, saying, oh my gosh, every Tuesday at 3:00, we get a call from, 69 Maple Street. So guess what? Let's be there at 1:00 next week and see if we can intervene. As I mentioned, the fact that they're using their data to highlight the high caller addresses in this RUTSTAT meeting, and in the, anyone can attend the meeting, whether they are from the faith community, from the Council on Aging, senior community, whether they're from, probation, parole. It's so funny because they'll say, okay, we've been at this address, and everybody nods their head like they know the individual there, and somebody will say, I'm on it, I'll be there, I'll go check on him or whatever. So, using the data to capture change over the community, but also at the individual level, happens with the new way that law enforcement was looking at their work. As you could see from the neighborhood, they were able to use data to show the change in the perception and the feeling of safety in that neighborhood. And then of course the data we have from healthcare is just definitely was focusing on, we need more treatment, because if we don't get people in treatment, they're still going to be drug seeking, needing to meet their needs. And so that's been huge, and being able to have enough of it throughout Vermont, not just in our community, so people don't have to drive hours for care. Because when all of this started, there was a methadone clinic in Burlington, and then one way up north in Vermont, and it was a mobile van. And now we have 6 or 7 methadone clinics. So that was a huge shift in terms of healthcare access.
Mm-hmm.
So,
Mm-hmm.
for each of our 3 pillars of work, data has certainly helped support showing that all these efforts are making a difference.
Mm-hmm. Yeah, I love the fact that you were able to get kind of that social cohesion. Like, is this actually making an impact? And I think you said that you got that from, was because there's a lot of door-to-door kind of community perception,
Yeah.
Gleaning. And
So, right. And that was NeighborWorks, because NeighborWorks is helping people usually affordable loans, renovations, but they were able to get a couple of AmeriCorps workers just to do this work around neighborhood engagement. And they're the AmeriCorps workers were the ones that would go door to door and tap into small little grants to be able to do some of these projects like the photo voice, the taking of pictures, and just, there's just so many different aspects of Project Vision. So the arts community had a place, the faith community had a place. Of course, all nonprofits are going to come to the table and try and make things better. There is an offshoot of a high school group that does meet within Rutland City, again, addressing, prevention. We don't see them that much because the Project Vision meetings are during the day and those kids are in school, but there is a connection there.
Mm-hmm. Great. Patty in Humboldt, I want to, kind of solicit from you. I know you've got a bit of a cold, so just thoughts on, what you're doing in your community. I know you're heavily involved in some of the stakeholder engagement, like just questions or any, what struck you from this?
I think one of the things that struck me the most is that, the police department had such a, essentially the police chief who initiated Project Vision and how they were the backbone organization. So that kind of, struck me in a good way, definitely. It seems like a lot of the improvements have been based on just the trust that the police have fostered in the community, which I think is kind of, it's kind of different to what we're seeing kind of like at the national level with, law enforcement.
Yeah.
So yeah, I thought that was really great.
Mm-hmm. And you guys have a police chief or the sheriff or somebody in your group, right, Patty, if I remember right?
Yes,
Yeah.
We do have the Humboldt County Sheriff as part of our governance committee, and we also have the Chief Probation Officer, who is a really active partner in our governance committee. So they're also very involved.
Great.
It's interesting that other communities in Vermont would love to model it, but they're having difficulty. It had to be organically developed. It had to address an issue. And prior to this, our police department had terrible morale. There were a number of situations that were not very complimentary to the police that happened a couple years before this, whether it be racism or other unfortunate activities of individuals on the law enforcement payroll that weren't addressed. So and we really needed a new police chief. And the previous one had been here way too long. So that too was kind of a perfect storm, needed to turn things upside down. So almost you need to hit bottom before you can climb up.
Yeah, certainly. It sounds like, with Rutland, that was the piece that really, unfortunately, unfortunate, right, that sprung you all into action. And just kind of the collective nature is what I'm also struck by. when you think about the activities, right, of an ACH, like it's owned by the community, right? Like all of these different folks are contributing, is certainly very much demonstrated, I think.
Yeah.
Yeah. So
And
other
it's very,
folks, oh, go ahead. I'm sorry.
I was going to say it's very organic because you never know where it's going to go next, you know, as people come to the table and bring something to add to it. One of the members she's very artistic. She's now doing a kids show on public access TV that has to do with kids and their emotions, realizing, yeah, so it's just very cute. You know, you just never know what's going to be added to the whole mix.
Yeah, well, and the fact that art, different forms of art, I think is something that's totally untapped. You know, as a intervention, I'll call it. You know, I think is interesting. Heather, I know you joined late. You know, I know you were probably running around. I don't know. I'm sorry because I know data is something that's really important to you, and so the slides will be available. You know, Heather is in LA, so in the city there, and has a community wellness. So there's a clinic and a variety of different, kind of a similar, in some ways, where it's a place-based model. So that's part of Project Vision. Any questions maybe that you might have just from where you were sitting at all? You know, from the little bit that you got to hear. So hopefully everything's okay.
Yeah, everything's fine, like you say, just running from another meeting to another meeting to another meeting. Anyway, no, but I really enjoyed hearing this, you know, this other case study, and it was very interesting. I really appreciated also the context of the engagement of law enforcement, because that's actually something we were talking about at the meeting that I was at just before this one, because we were talking about our undocumented population and also our survivors of violence and crime, and just how do we make, you know, the relationship with law enforcement more supportive of that community and less of a barrier to our clients seeking care. So yeah, it's very interesting to hear another model that's been so successful, and how it's been such an opportunity for your whole partnership to kind of rally around this optimistic moment around coordinated care for your residents. So that's very exciting.
Mm-hmm. Yeah. Yeah, so I don't know. So Kate, I'm going to pick on Kate today. So Kate is actually fairly new, but she's an AmeriCorps. So you talked about the use of AmeriCorps, which I'm very intrigued by, you know, the use of AmeriCorps volunteers. And, you know, it sounds like you use them for a lot of community engagement, used for photo voice, which we've talked about with this group, the idea of using that, to really engage where people are coming from. You know, I don't know, Kate, if you, from the work that you've done over the last year and a half, any thoughts, ideas that you could maybe take into Lake County?
I think that's one of the greatest parts of me being here was that I was so available for community outreach. So I did a lot of tabling events and going and doing Weed Recovery Happens, which was an event all day, where we had speakers come and share their stories. We also handed out information from SafeRx and safe prescribing guidelines, things like that. So I got a lot of face time with a lot of the community, so I could come back to our meetings and say, I was at the Veterans Stand Down event, and there were a really high population of elderly that have a ton of medications just laying around that we need to figure out where they can put these. So that led to other things. And in the search of me trying to find ways to get a drop-off location, I came across this product called the Terra, which has been really great for our community, that you guys may have some interest in. I don't know if any of you are familiar with that. The Terra, it's called. It's a drug deactivation system. It's similar to what Walmart is just launching, but it's a pouch with a carbon compound inside of it, and you add your prescription medications,
oh, wow.
child, yeah, it's awesome, and it's biodegradable. So if a child or any one were to get their hands on this medication, it would be harmless, essentially. So I've gotten a lot of opportunity to work on my own so that I could go back and talk to the team as a Vista, and because you can't do direct service also, so keep that in mind for your Vistas.
Yeah.
Sorry about talking.
Yeah, that's okay. So I think, Sarah, just the idea, and for all of you, if you've not kind of further thought about the idea of AmeriCorps Vista, as an extension of the work, it sounds like it was really helpful and useful.
Yeah, I would be more than happy to speak with any of you about my experience or any suggestions I have. We'll be getting some Vistas in the future too to help with our work.
Great. Thank you, Kate. Any other comments or at all? Great. Sarah, any closing thoughts or words of wisdom, advice? Anything that you'd like to share?
Well, I hope everyone has an opportunity to look at the Project Vision website. It does have, the latest information from the most recent meeting, but as I looked at it, some of the information's not up to date. That was initiated by a volunteer who then moved out of the community, but it is a great place, for people to go to get some basic information. So that's been very helpful. The other piece that Project Vision is great at doing is communicating. When Scott Tucker was there, I would probably get, 5 emails a day from Scott, and many of them would be, hey, this person has a client who just moved into an apartment and they have nothing. Does anyone have a bed on a bureau? And before the end of the day was over, Scott would go, okay, we're covered, we're good.
Wow.
And it was just so heartwarming to know that the community was coming together to meet the needs of the individuals. I still remember there was a plea once, and I had a couple of pieces of furniture. So I found this apartment in downtown and dragged the, furniture up this narrow stairway and into this little tiny apartment. And the woman was there with her 18-year-old. And she goes, we have been living in a motel for over a year. And this is our first time of having, a kitchen in a place like this. And she gave me the biggest hug. It was just so heartwarming, to know that sometimes, because we sit here and, we do strategic planning and, we have all this paperwork and, it can get very detached from the day-to-day individual needs of people. And so just being able to participate at that level is a great opportunity as well.
Yeah, that's great. One of the things to the California group before we got started, Sarah and I were on, and in Vermont, they have 9 core elements. California has the 7 core elements. What's in Vermont that isn't in California is communication and community engagement. Now, that doesn't mean you as sites can't address those things, and I think often you are, and we know communication is a huge issue, and that role that you're playing as the backbone around facilitating communication is quite important. And so I just don't want to lose kind of those 2 pieces that I think, Vermont called that out and said, really, to operate in an ACH, we think those are important. Because it's a big piece. And as you're discovering, right, this communication and how you do it in a way that's meaningful is really important. So it sounds like, how it was working there, was working for the Rutland area. So, well, great. Well, thank you for joining. I appreciate it, and very, very grateful to you, Sarah. And hopefully you will have lots of rations with your coming 12 inches of snow,
Oh, yeah.
which is a lot.
I've got my,
That's
I
great.
have my skis. Yeah, my skis are in the car, so I'll be good.
Yeah, that's very good. Very good. Great. Well, thanks, you guys.
Okay, thanks for having me.
Okay.
Thank you.
Bye.
Bye-bye.
Bye.